My name is Timothy Watkins, and I'll be giving you a brief, informative speech. The purpose of my speech is to explain exactly what obstructive sleep apnea is, along with the associated symptoms and treatments. Do you ever or often wake up feeling sluggish or tired after a full night's rest? Afterwards, do you contemplate even getting up to go to work or even school? Just one more hour and I'll be good. Is this possibly you? Yes? No? Maybe so? Obstructive sleep apnea is a disorder that occurs when a person's breathing is disrupted periodically during sleep. In the spring of 2014, after conducting a sleep study in Manhattan, Kansas, I was diagnosed with obstructive sleep apnea. Early recognition and treatment of obstructive sleep apnea is more than often associated with irregular heartbeat, high blood pressure, depression, and ultimately can be fatal. Due to the serious disturbances in normal sleep patterns, people with sleep apnea often feel tired and fatigued during the day. This causes issues with concentration and overall daytime performance. To begin with, let's first take a closer look at what causes sleep apnea. In some people, apneas occur when the throat muscles and tongue relax during sleep. When this occurs, the relaxation of the throat muscles and tongue partially block the opening of the airway. We all have a small fleshy tissue in the back of the throat called the uvula. And when it relaxes and sags, the airway becomes blocked. This results in low levels of oxygen and increases the carbon dioxide in the blood. Breathing then easily becomes strained and can stop altogether. The reduction in oxygen immediately alerts the brain, causing snoring, even gasping for air. Carrying excessive weight also allows for excess amount of tissue in the throat, causing the airway to narrow and prohibiting that flow of air through the nose or mouth. More information can be found at the William Beaumont Army Medical Center for Sleep Medicine and Technology. Equally important to knowing what sleep apnea is would be recognizing the various symptoms associated with its condition. The most common signs and symptoms of obstructive sleep apnea are more prevalent than many actually comprehend. The first symptom, loud snoring. However, not everyone snores. Other associated symptoms are morning headaches, excessive daytime sleepiness, also known as hypersomnia, and irritability. Other symptoms include difficulty concentrating, memory loss, and fatigue. You can find further information on this at the National Center on Sleep Disorders Research. Lastly, however, there are distinctive methods and self-care options to help mitigate the effects of sleep apnea. The use of a CPAP, or continuous positive airway pressure machine, is the most common effective treatment. My good buddy here, Chance, is going to help me show off my visual aid here. With this method, a person will wear a full face mask covering the nose and mouth, which is connected to a plastic tubing attached to the CPAP machine's air blower. Air pressure is set to an individual's specific needs, forcing air through the throat, preventing it from collapsing during sleep. More information on the CPAP machine and how it works can be found at sleepfoundation.org. In addition, obesity is more than 50% of the cause in people with sleep apnea. So losing a few pounds can be the difference in limiting the effects and severity. Other self-care options include not smoking. Smoking increases swelling in the upper airway and can aggravate existing conditions. Also, sleeping on your side or abdomen can limit issues with obstructions in sleep apnea. Today I discussed what obstructive sleep apnea is, along with its associated symptoms and treatments. In conclusion, in order to spread awareness, we have a collective duty to understand, inform, and share that obstructive sleep apnea is a common sleep disorder that occurs when a person's breathing is disrupted periodically during sleep. As mentioned previously, due to the serious disturbances in normal sleep patterns, people with obstructive sleep apnea often feel tired during the day, which can cause issues with concentration and overall daytime performance. Conclusively, sleep apnea is an unimaginable, grim sleep irregularity that is far more common, in which breathing frequently stops and starts. Please share what you've learned today. Stop risking your health. With a good night's rest, we all can conquer the world. Thank you.